Hi, everyone. Again, thank you for joining us today. We're going to go ahead and get started. I am Macy Calvert, a program officer at the Bob Woodruff Foundation, and we've had great turnout and interest with this event, so we welcome everyone and appreciate your engagement. And for those who do not know the Bob Woodruff Foundation, our Got Your Six network is the largest non-governmental network of organizations serving our military and veteran community. The network is made up of veteran-serving organizations of varying sizes, maturity, and focus areas across all 50 states, Puerto Rico, American Samoa, and Guam. We are a thought leader, a funder, and when it's helpful to our community, and when we're trying to understand thorny issues, we are a convener. We would like to thank our presenters for taking time out of their busy schedules to join us today. I'm thrilled to have these experts here with us to help us learn what is available through the Food Security Office and how to access these resources to help improve the food security of veterans in your community. We are joined by Megan Bowman, MSRD, and she is the current National Nutrition Food Security Program Coordinator for the Food Security Program Office. And we also have with us Caitlin Solardo, who is a licensed clinical social worker who currently serves as the social work program manager for the VHA Food Security Program. And I'm going to now hand it off to our experts to dive in with their presentation. Thank you again, everyone.
Thank you so much, Macy. And special thanks to the Bob Woodruff Foundation just for allowing us this opportunity to connect with all of you. We greatly appreciate it. We're excited to share with you a little bit today about our office and the work that we're doing and opportunities to partner with VA in the work that all that you are doing to serve our veteran community. And we're going to start off a little bit with just kind of a level set on food insecurity and veteran food insecurity, just so that we can offer a greater context to some of the work that we're doing. So for our office and generally our definition of food security is a lack of consistent access to enough food for an active, healthy life or a household level economic and social condition of limited or uncertain access to adequate food. Obviously differing than hunger, the individual level physiological condition. And what we're really looking towards and our true north is nutrition security, being the consistent and equitable access to healthy, safe, affordable foods essential to optimal health and well-being. So when we look at a quick snapshot of food insecurity across US households, we can see that over 38 million Americans live in food insecure households, and that the higher rates of food insecurity exist in the South, followed by the Midwest, West, and the Northeast. When we look a little bit at our rates of veteran food insecurity, we can see that our higher rates of food insecurity centralize around female veterans and also our post 9/11 era veterans. In this last fiscal year alone, VHA has done an incredible job screening veterans for food insecurity, screening over 2.6 million veterans. Our positivity rate, though, given the context of our data, is probably a little bit lower than it actually is for a whole host of reasons, but our positivity rate is hovering right around 2.5% of those veterans screened. And we continue to work towards fleshing out our screening process, improving our screening process, and socializing more consistent screening across the board so that we're able to catch more of those veterans who may be on the border of food insecurity. VHA has really leaned into food insecurity as a social determinant of health, really a driver of health outcomes, fitting right in with things like financial problems, legal issues, relationship issues, unemployment, underemployment, housing instability, and homelessness. So really recognizing that the tie between those social drivers of health outcomes, right? And knowing that where one exists, so if somebody is struggling with financial problems or struggling with unemployment or underemployment, it's very likely that other social determinants of health related needs exist. So acknowledging the interplay between all of those needs is incredibly important in the work that we're doing. Some risk factors that we see for food insecurity. So first, socioeconomic status. We're talking about households that are near or below the federal poverty line, underemployment or unemployment, high housing costs and inflation, certainly something that's impacting everybody right now, and stressors to the household budget. This can be a little bit more nuanced, job loss, loss of benefits, even something like gaining a household member or losing a household member. Maybe there was a contributing member to your household who no longer lives there, maybe separation or divorce, death in the family, or maybe you've gained a family member, a new baby, an elderly relative, somebody else who is quote unquote another mouth to feed in your house. All of these are considerations when we're looking at our veteran food insecurity. And what it results in more than anything is choices, it's competing priorities. So given all of these things, housing, transportation, utilities, medications, food, healthcare, imagine for a minute that maybe you're struggling with a mental health condition that makes it difficult or challenging to access help or leave the house. Added on top of that, the stress that comes with food insecurity or feeling like you can't put food on the table for yourself or for your family. Now, add on top of that, maybe you've also got a medical condition, something like diabetes or heart disease that requires frequent medical appointments, medication management, and monitoring and time and attention. And so, where does all of this fall in the competing priorities? So, I always invite audiences just to consider if you are faced with having all of these different choices, sort of how would you prioritize? How have you prioritized? Many individuals are faced with these competing priorities. So just to kind of keep that in mind as we continue talking. So we also recognize we're Veterans Healthcare Administration. So we're really looking at the connection between food insecurity and health. We know that food insecurity is associated with a wide range of adverse health outcomes, things like poorer control of diabetes, issues around blood pressure, obesity, COPD, HIV, depression. We know that it increases risk for hypoglycemia, cognitive dysfunction and falls, high prevalence of food insecurity among patients who frequently utilize emergency departments. So that's another way in which we sometimes connect with our food insecure veterans. They may not be our veterans who are connected to consistent care. They may just be coming in and utilizing the emergency department, and this may be part of the issue. Research suggests that food insecurity alone is associated with poorer health outcomes beyond a lack of access to medical care and medication. So important, food insecurity is so important that in and of itself can actually be a driver of health outcomes. Chronic disease also can worsen in the absence of good nutrition, and physical and emotional stressors of the inability to meet your basic needs can certainly exacerbate chronic medical or mental health conditions and precipitate new acute conditions, and also make it difficult to access the needed resources. That's a lot of sort of where we interface with the community as we continue to talk. Well, how likely are our veterans to access help, to access resources, and how can we encourage them to access help? What do we need to do to reduce barriers to gaining support in the needed social determinants of health areas? So a relationship really does exist between the availability of appropriate nutrition and medical nutrition therapy and high healthcare costs. And our food insecure veterans are often more likely to have depression and suicidal ideation, more likely to have issues around substance use or alcohol use, more likely to be of a racial or ethnic minority group, have a lower BMI, be HIV positive, and again, more likely to have low income, unemployment or underemployment, recent housing issues. So again, they're more likely to have other social determinant of health related needs, and all of these sort of weave together as we think about how to address veteran food insecurity comprehensively. And with that, I'm going to turn it over to Megan to talk a little bit about the work that we're doing in our office.
Thank you, Caitlin. So we want to level set a little bit here and talk about how our work came about. And really, we've been working on veteran food insecurity for a number of years, but the White House conference in 2022 really helped to amplify our messaging and the need to address food insecurity, and particularly in VHA among our veteran population. So the White House strategy to end hunger by 2023. Again, it began with a White House conference convening, which we were able to take part of by sending representatives from our office. And there are three strategies that are directly related to the work that we do here in the Food Security Office. And first is connecting veterans to resources. Second, implementing and evaluating food programs so that we ensure that we're connecting our veterans with the right programs that are going to work for them with their unique needs. And then third, establishing a new Office of Food Insecurity within VHA. And that's where Caitlin and I come from to you today. The Secretary of VA also implemented in his strategic plan a strategy related to food insecurity. And this states in the plan that VA identifies veterans and transitioning service members at risk for food insecurity and connects them to resources, assistance, programs, and education to improve their health and well-being. So again, music to our ears here in the Food Security Office, and just what we set out to do. This slide contains information on our VA financial policy as it relates to our ability to purchase food. And it's important because it's something that we must consider as an office as we create programs and pilots. And really, it emphasizes the need for building solid partnerships, which I'll talk about in just a few slides here. I also want to bring up the idea that food is medicine as it helps to drive our work. And we are a healthcare system, as Caitlin mentioned earlier, and so we'd be remiss not to implement these philosophies as well as the associated food programming. So food as medicine is defined as the provision of nutrition education and food in support of health. We are proponents of this by implementing our VHA Healthy Teaching Kitchen program in our efforts and the interventions that we provide to food insecure vets. This is available to veterans in VHA regardless of income and needs, and we've developed special programming and education just for the food insecure vet in teaching them how to use foods that are available to them to create nutritious meals. Food as medicine also focuses on individuals who are food insecure or who are at risk, and access to food programs such as medically tailored meals, produce prescription programs, prescribed grocery delivery programs, food hubs, and other supportive services. It supports prevention and disease management, but it's not intended to replace the use of medications or other treatments, is how we practice within VHA. Next slide. So let's talk about the Food Insecurity Office. We've mentioned it several times, but I'm going to kind of give you really the framework that creates our office and our purpose, mission, and vision. Purpose really is to support veteran whole health by ensuring food security. And the whole health of the veteran is something that VHA really champions, and access, again, to nutritious food is paramount to that. Our mission is to ensure that all veterans have equitable access to nutritious, affordable, and culturally appropriate food to support veteran whole health through data management, partnerships, and using evidence-based strategies to inform healthcare delivery. And our vision is just to create an environment where all veterans are nutrition secure. So more about the nuts and bolts of the office. We were approved to stand up our office in March of 2022. And it's an interdisciplinary focus where we have a couple of dietitians, social work, nursing. We have a comms employee focused on legislative affairs and public affairs, and then also program support. In short, really, we aim to maximize and align efforts by providing support, expertise, and advocacy for VA. So we really look to coordinate and consult with the field and help them, and in helping them with their food insecurity, or food security rather, programming. We are built on 3 pillars, which include partnerships, data management, and research and education. And I'm going to break those down a little bit further in subsequent slides. Just a quick history of our work. I won't go through all of this in the interest of time, and I'll let you kind of read through this. But our work started in the spring of 2016, and it was carried out through actually a work group that was chartered that myself and Dr. Christine Going, who leads our office, we chartered the work group and stood it up and started getting to work. We did launch a clinical reminder that is used to screen the veterans for food insecurity, and it's contained within the EMR. By October of 2018, we screened just under 3 million veterans. We were very excited about that. You can see I've already mentioned that in March of 22, the Food Security Office was approved. Again, September 2022, the White House conference was convened. And then by June 2023, we were fully staffed. And you can see at the end of our fiscal year, just this past September, we screened about 11.5 million unique veterans. And so we're very proud of the work and that the last 7 years has really been devoted to. So going back to our 3 pillars within the partner or in our office, partnerships is key to or are key to our success in being able to create and stand up and pilot programs that address food insecurity for our veterans. We enjoy both internal and external partnerships. Internally to VA, again, I mentioned how important that interdisciplinary approach is. So you can see nursing service, social work, nutrition and food services, the Office of Healthcare Innovation and Learning, they're crucial in innovating our food insecurity programs. Really, it takes a village to address this, and you can see we've tried to honor that with the partnerships internally that we've made. And then externally, we have memorandums of agreement with USDA, the Rockefeller Foundation, and then enjoy close collaboration with entities like the DoD, organizations like Mazone, the FRAC, and Feeding America. Our next pillar is data, and data really helps to inform where and how we practice. And you can see in front of you, this is a data dashboard that was created based upon screening information that's derived from the electronic medical record. And this is just a snapshot of what can be seen, where we can look to see how many patients or veterans were screened, how many screened positively for food insecurity, as well as how those patients were triaged. So you can see that we're tracking referrals to a dietitian in nutrition and food services, as well as those who are referred to social work. And then we can drill down even further. We can look at our food insecure veterans by gender. We actually have race now. We need to update this to reflect our new measure or monitor in race, but gender, ethnicity, age group, and then even period of service, so that we understand what our veteran population looks like. Our last pillar is research and education, and we've done a lot of this over the years, and it really, just as we're educating you in terms of our work, we educate both internally and externally to our partners. We've provided a number of education to different VHA offices and services. We've collaborated with the USDA to offer external partner education. We do, on a regular basis, every day in the office, provide individual site consultations. So again, one of our main objectives with this office is to coordinate the efforts that exist within VHA, so that, again, we're all moving toward the same result in establishing food security among our veterans. And then last, supporting research in the food security space. And we're going to show you some different studies that have been carried out specifically by VA researchers that we've been a part of. We are also working on a produce prescription program in partnership with our friends at the Rockefeller Foundation that's being formally evaluated by the University of Utah. We'll switch gears in terms of another activity that we are involved in, and this an activity makes it sound a little bit small, but this is really wonderful and large undertaking that we're participating in the office, and that is being involved with the National Defense Authorization Act for fiscal year 2023. And this is essentially a pilot program to combat food insecurity among veterans and their family members. And so as an office, we are working toward establishing a pilot program to award grants to eligible entities to support partnerships and address food insecurity among, as I said, our veterans and their family members. And these are veterans who receive services through vet centers or other facilities of the department as we determine. And then in these grants, we're looking for organizations to provide programs to support the following food insecurity initiatives. And we have 5 listed here. First is to support an on-site food pantry program. So standing up a food pantry that will be able to be utilized on-site by the veterans, supporting a produce prescription program. And again, we see those come in all shapes and sizes, supporting a medically tailored grocery delivery program. And this is newer actually in the space of food as medicine, but medically tailored groceries are essentially groceries that are approved by a registered dietitian that reflect their dietary needs and support the nutrition management of these patients, or the medical nutrition management rather. And then fourth, support a medically tailored meal delivery program, and support an agricultural related or farming program. So this really runs the gamut of what individuals who are interested in this work can be involved in, and we're eager to get this pilot going and see the creativity and the innovation that may come to us with eligible grantees. Next slide. Going back a little bit to the research, I mentioned that we enjoy partnerships, internal partnerships, as well as external, but these publications represent partnerships with our internal VA researchers, and you can see that there are some publications listed here that have really been interesting and informed some of the work that we do, things related to looking at the relationship between food insecurity and mental health, like suicidal ideation and depression, as well as risk factors for food insecure vets. There's some active research where a VA medical center is implementing the food insecurity clinical reminder and looking how that's implemented, as well as ways that the process can be improved. We're always looking to improve our screening, as we can't help hungry vets if we can't identify them appropriately. So this is just looking at current processes and how we might improve if needed. And then some quality improvement research. We're working with the Office of Rural Health to develop effective evidence-based strategies to address food insecurity in the rural veterans, which comes with rurality, comes with its own issues, barriers, and we're working to see how we might overcome and serve those vets. And then last, we're involved in the ACORN study, which is a survey that assesses circumstances and offers resources for needs. So Caitlin talked about social determinants of health, and in addition to food security, this looks at other social determinants, as the relationship can be strong. Caitlin mentioned that if you're struggling with housing, then you are likely struggling with getting food. So this is something that we're excited to see some data from, and that has been kicked off. So next slide. Just some suggested reading here, additional publications that you might find interesting. We've got links to them in this slide, but just to again paint a picture of what food insecurity looks like for our veterans. Here is our office in photo here. So office contacts, you see myself and Caitlin. Christine Going leads us. Tracy Squire is our nurse. Jason Melton is our communications. He's an executive officer in our office, specializing, I said, in communications and legislative affairs. And then Karen Escalopio is our program support. And so if you have any needs, questions, or want to follow up, please contact us. We'd be happy to help.
And I will go ahead at some point and get our, at least a few of our email addresses dropped into the chat in case folks have any questions.
Perfect. So I think the last slide here, Caitlin, is what can we answer for you?
The first question comes in from Suzanne, and it is, how are connections made between organizations and the Food Security Office?
Oh my goodness, that's a great question. And also we do have Dr. Christine Going, who's our senior advisor, is also on the call. So Christine, if at any point you'd like to jump in, we are happy to have your voice as well. So I'm going to say from my perspective, no wrong door. Organizations sometimes get connected through a local medical center, a local facility, something in their region. They happen to know somebody, know the right person. Sometimes they get connected through us directly. And part of that conversation really focuses on when we're talking about an organization and how to partner with an organization, the pathway to, are we considering sort of a national level partnership, or are we considering a local level partnership? We're a national team, a small team of 6, but we are sort of this umbrella over everybody else across the enterprise. And so often what we're encouraging is local partnerships, depending on the type of agency, but there are certainly, if you think Feeding America, USDA, there are certainly agencies that we have a national level memorandum of agreement with, but no wrong door. Certainly any agency with questions about how do I get involved, a lot of the consultations that we do sort of externally are agencies that are coming to us just saying, hey, we want to know more about the work that you're doing. We heard you exist, which is good, but also how can we partner? I feel like that's the question we get all the time. How can we partner? What can we do? And so often that's a conversation just between us and the agency to find out, well, what does the agency do? Where's their focus population? What services do they offer? Where do they offer, what's their catchment area? And then often we serve as that warm handoff, because sometimes people or agencies are challenged by trying to figure out, who do they talk to at a facility? Who do they talk to at the local level? It's not like you just dial into the operator and figure it out. So sometimes our role in that situation becomes navigating and providing that warm handoff and that warm introduction, in terms of getting them connected. And Dr. Going, I see you have your hand raised.
Hi, yes. Just tagging on to what you said, again, who do I talk to? Again, we would be more than happy to help you, but if you do know people at a local facility, and again, I think local connections are your best bet. It is likely going to be the social work department or the nutrition and food services at a local facility. So if you have connections there, or if when you're dialing in, you're saying, can you connect me? I would ask to be connected to social work or nutrition and food services. Either one would be in a position to help with you in specific to food security issues.
Thank you so much, guys. That was really helpful. And our next question is, are veteran service officers aware of this important initiative/office? Additionally, what efforts are being taken to share with CVEBs across the country?
I'm going to say I hope that many veteran service officers are aware, but I will say we have spent the better part of our last fiscal year sort of, as I refer to it, on parade, getting audience with whomever we can to share the work that we're doing, to share that we are new. We were fully staffed. We were approved in March of 2022, but we really weren't actually fully staffed with all of our human beings on board until March of 23. So we are a brand new office. So we have spent the vast majority of our time finding audience with whomever we can to broadcast what we're doing. And so even if something comes as an offshoot of this call, if there is an agency or an opportunity or an audience that somebody thinks we should have, we can always talk about doing a follow-up call, talk about doing a consultation with a different group if that's needed as well.
Thank you. And our next question is, how can I assist my veterans in connecting with the food security office in my particular area?
That's a great question. And it also sort of highlights some of the, I'm going to say, marketing needs around what we're doing. So the food security office is just a national entity, and each VA specifically doesn't have a food security office. Food security is sort of embedded in the work that's being done. It's sort of infused in the work across disciplines at sites. At least that's our goal and objective, is to make it more consistently infused. Some sites have chosen to have a dedicated full-time position to food insecurity. So I can think of 2 sites across the enterprise that have food security coordinators. So at those particular sites, it's a little bit easier because then you can call up and speak to a food security coordinator. But as Dr. Going mentioned, getting connected with social work or nutrition and food service is probably your best bet. If you have a veteran in front of you, probably your best bet is to start with social work, start with nutrition and food. Need to find out, is this veteran registered for healthcare? Are they eligible for healthcare? One of the beautiful things about our partnerships, our external partnerships, is the ability to have that bi-directional referral. So we can refer veterans for services to our community partners, but also our community partners can help identify veterans who we don't know are out there. Maybe veterans who are not enrolled in VA healthcare and they're eligible, didn't even know they were eligible. So it's a way also to get them connected to the wraparound services that we can provide, all the things in our wheelhouse. Just even getting them to us can sometimes put them in the right place for that full comprehensive assessment. And Megan, I see you have your hand up.
Yeah, I'm just going to tag on to that and make sure that everyone understands that VAs across the country all have varying levels of resources as well. And so you might find a food pantry at one medical center, whereas another may not have a food pantry. Now, we're hoping to change that as an office, but they might have the Healthy Teaching Kitchen program. They might have boxes that they're able to give to veterans, or bags of groceries. But we are working, again, to standardize what's available across the country. But really, as Caitlin said, the best thing to do is get in contact to see what they do have to connect your veteran to them. So thanks.
It's really interesting that it can be an open door for a deeper connection with VA resources by getting connected with this office. I think that was a great point. And our next question is, earlier it was indicated that the VA has screened 11.5 million veterans. Do you have this number broken down by state available to everyone? Or later on, maybe available to everyone?
Yeah, I can take that. So we do have the data, and it's broken down by medical center across the country. Gosh, most states have at least a medical center. We have community clinics all over the country, but we do have that. We take a little bit of consolidating in terms of looking at the data state to state, but we do have that available. And if you're just looking for aggregate numbers, then we can certainly help with that information.
Very helpful. And I'm going to take that opportunity to mention to everyone on this call that this is being recorded and will be sent out to everyone who registered afterwards. And I will include some of the resources mentioned here today in that email as well. And the next question is, what type of partnership programs do you have for veterans who don't eat the standard American diet? For example, vegetarian/vegans. If not, are you looking into diversifying these food programs to meet the needs of veterans and their families with alternative lifestyles?
Yeah, I'll take that one as well, just as the dietitian in the office. But we do, one of the beauties, again, of our program is that we have the social worker who's going to really help connect the veteran with the resources. But then the dietitian is able to come in and take those resources and tailor them to the individual needs. So we can consider dietary preferences, whether they're vegan or vegetarian or whatever dietary preference they might have. And then we can also tailor recommendations and provide education to the veteran related to their healthcare needs. So if there's presence of diabetes, if they have congestive heart failure, then the dietitian can really work with a veteran and prescribe medical nutrition therapy to ensure that they're looking at the foods that are available to them and choosing foods that are appropriate and that will help to support their health. And some of that is in practice right now through the Healthy Teaching Kitchen. Some of the pilot programs that we have nutrition education and even one-to-one counseling with dietitians built in into those services as well. And so we're really able to honor the wants, wishes, and needs of the veteran, nutritionally speaking. So, and fruits and vegetables, produce prescriptions all over the place. We're hoping to increase our numbers even more in terms of the offerings that are available. But that's really, we're hoping to support not only food security, but as Caitlin mentioned, nutrition security on one of her first slides there. So hopefully that answered the question. Okay,
Thank you. That was a great question, and that was a very interesting and helpful answer. And our next question will be, what would the difference be for a veteran between the tailored grocery delivery program and the tailored meal delivery program? If they are different, would it be possible for a veteran to be eligible for both?
Medically tailored grocery delivery means that you would be working with a dietitian and based on your medical nutrition needs, like Megan just mentioned, do you have hypertension? Do you have congestive heart failure? Are you diabetic? The veteran and the dietitian would figure out what foods you would need, and then they would come up with a grocery list, and then the grocery list would then be procured and delivered to the veteran. Versus medically tailored meals, the meals are actually prepared, again, based on your medical nutrition needs, and then the pre-made meals are then delivered to the veteran, and the veteran would just need to heat them up. So it's actually a degree of there's a subtle difference, because groceries are going to be delivered, think of them as ingredients, and then the veteran would have to prepare the meals themselves. Medically tailored meals are going to come in their meals that are pre-made, and they're usually frozen. So you might want to think of like a TV dinner. They're going to come ready for you to heat up and then eat. And again, in both cases, they are medically tailored, meaning that they are specific to the veteran's medical nutrition needs. Does that help?
I think so. And based on your answer, my understanding is you probably would not then be eligible for both, but you pick one or the
Yeah,
other.
you're going to do one or the other. You don't do both. And again, these programs don't exist right now. These are part of the legislation and those grant programs that Megan spoke to you about that we are working on right now, and that will be available in coming years. Once we work through the legislation process, we will be offering these grants out. And then once those grants are live, these are programs that will be offered as a result of that legislation. But if you work directly with your medical centers that you are aligned with, there are some medical centers that do offer these programs based on community partners that they might have. So as mentioned a couple of times, your best resource is to connect through your local medical center to your chief of social work and or chiefs of nutrition, and even going through primary care and working with a nurse and asking to be connected to social work or nutrition. That's another way in. So back to what Caitlin said, there's no wrong door. If you go into a VA medical center and ask for help with food security, they will connect you. I hope that helps.
Very much so. Thank you very much. And our next question is, does the veteran need to be enrolled in whole health currently to have access to food security help?
Great. There's not necessarily, or there's not an enrollment per se in whole health. Whole health is sort of a philosophy that is infused in VA care. So if the question is, I want to make sure I totally understand the question, but if the question is they need to be enrolled in VA healthcare in general, typically that's the access point for individuals is to get enrolled. But also that's a really multi-tiered issue, and eligibility for programs and services in the future may not be as narrowly focused as they are currently. So I would say your first point of action is always to see if a veteran's enrolled for healthcare, see if they're eligible for healthcare. But there are support and services and things available to veterans who are, well, if they're not enrolled, we can help them get enrolled. But if they're for some reason not eligible for VHA healthcare, there are ways that we can look to address that depending on what the specifics of the situation are.
I think that was a very helpful answer. And I think that it also speaks to the future of your office and where things may go as you continue expanding. So thank you for that context. Another question is the food security screening an annual thing with the veteran's primary care doctor?
Yes, the screening itself is the 2-question hunger vital signs screening, and it, for lack of a better term, it lives in primary care. So veterans can be screened at any time, anywhere, by any person in any appointment, but it pops up in primary care annually.
Thank you. This is an interesting question, I think, as well. What is or are the biggest challenges your office is facing, and what are the barriers you face in executing your programs?
Building the plane while we're flying it. That was just my off the cuff response. I think this is, it's a large issue. It's a population health issue. It's not even just a veteran issue. So when I say no wrong door, we literally mean no wrong door. So as we build the infrastructure of this office and identify purpose, mission, vision, and start to make all these connections, I think it is, at least for me, it's challenging to make sure that we have everything sort of channeled in the right direction and that we're managing and prioritizing all of these things as they evolve really, really quickly. I also think we're just challenged by getting the word out there. I don't think we're challenged by it being received. People are always happy to hear from us. They're always excited. Nobody's ever not happy that we exist, but getting that audience and making sure that we spread the word, and sometimes feeling like just when you think everybody must know who you are in your old news, somebody's knocking on the door saying, wait, there's a what office in the VA? So I think both of those things, just in terms of building an office and getting the word out there. I'm sure, Christine, you'll probably have something much more eloquent than that.
No, I was just going to say our biggest challenge is just that we need grace from people like all of you to allow us the time to build the infrastructure and then roll out different initiatives. So because again, the office is less than a year old, being fully staffed, it's really just looking for grace with our community partners to allow us to get the program set up and implemented. So I would say that's probably our biggest challenge.
Thank you, guys. And this is a constant question we have in all of these upstream issues, and that is how is the office able to support rural veterans who aren't close by a VA medical center?
That's why we're really excited and working towards the different grant programs that you saw as Megan outlined it. There's 5 different types of grant programs, and part of the reason for that was to meet veterans where they are. So be it a medically tailored meal or the medically tailored grocery delivery program, those are really intended to help meet the needs of veterans that are either rural veterans or veterans that might live in an urban environment but in a food desert. So that's why there's 5 different programs that we're looking to pilot. But some of the produce prescription programs can also support rural veterans. So that's why right now the office is excited about moving forward with that legislation and eventually rolling it out and then measuring it so that we can see what worked and what didn't. But those, I would say those are how we're meeting it. But again, because our VAs know their population, working directly with the facility you're closest with can also help, because certain facilities will have stronger rural programs if the majority of the veterans they serve are in a rural setting compared to, let's say, a Manhattan or Boston, who might be more focused on serving an urban environment and meeting the needs of food deserts. So that's why we're prepared and working towards both.
VHA also does have an Office of Rural Health, and so they're one of our internal partners, and really another relationship we're looking to foster and grow. And VHA has turned its eye a little bit to, in the last 2 years for sure, the needs specifically of veterans who live in rural and highly rural areas, and how to assess some of those unique needs.
And that reminded me, thank you, Caitlin. As a result of the pandemic, when most people were kind of, hunkered down at home, the VA did a lot of work in trying to bridge what they call the digital divide. So many of our programs have pivoted and have virtual options. One of them is the Healthy Teaching Kitchen that Megan spoke about. So in the past, where you would go to a medical center to participate in a class where you would learn how to cook foods based on your medical nutrition needs, many of those classes have pivoted so that you can join them virtually. So particularly for the rural veteran who might not live close to a VA or to a CBOC, they can still participate in all of the educational series using virtual options. So it's another way we're trying to meet the needs of our rural veterans.
Thank you very much for that. And another question is, this might be a difficult question, I'm not sure, but what are the measurement metrics you determine whether or not we are actually solving the food insecurity problem for our veterans?
So good question. We're working towards that. And that's, again, I hate to keep going back to the legislation, but that's exactly what the legislation is going to help us do, because we want to measure those 5 programs, because we believe those 5 programs will have significant impact, but each one of those grants will have metrics associated with it. And that's how we'll be able to measure the impact of those programs on our veteran population. And that's kind of what I meant by asking for grace from people, because we're going to need time to roll those grants out and then to measure their impact. However, we also currently have research going on. So Megan did mention that we have a number of produce prescription programs that are currently in effect right now. And all of the programs we do have metrics associated with them. And the produce prescription ones actually have formal research associated with them. So we're really excited about measuring those outcomes. And those outcomes are both in clinical outcomes. So they're going to look at somebody's hemoglobin A1C or their blood pressure or their weight, but it's also looking at mental health and well-being metrics. So we're really excited about those, but again, they take time. But we do have a number of metrics in the hopper, and we're looking to see which ones are the right ones. And we're also looking to see which additional metrics we should add as the office grows.
I'm just going to tag on to that, make sure I'm unmuted. And just, I mentioned food hubs within the VA as a portion of our programming. And just those are, I wanted to describe what they are, because I think it's really innovative and unique in terms of something that we can offer to the VA. But a food hub is essentially, we say a food pantry on steroids. So Dr. Going likes to advertise this at, but really a food hub it serves as an access point of care to the veterans. So we talked about those wraparound services. And when a veteran enters a food hub, they're able not only to take home food that day, but they might also be connected with other services that they would need and might be related to their food insecurity. So mental health services, social work services to address those other social determinants of health. And we are piloting these food hubs right now in VA. We have 12 sites that we're working with that are converting their food pantry to this food hub. Again, that's really a robust service in terms of what a typical food pantry looks like. And we are standardizing metrics with that program or that pilot as well. And so again, we're just looking at every corner and every turn. We want to measure what we're doing again, so that we can see what the impact is and make sure that our programming is appropriate. So just want to plug those food hubs as well.
Thank you. And you actually addressed another question we had about pilot participants in that answer. So thank you for that very much. And then we have just 9 minutes left. So I'm going to ask one more question and then we'll wrap up from there. So our final question is, what happens when a veteran is screened with the Food Security Office, and are direct food resource connections made for them as the process currently stands?
At the facility level, if a veteran comes in and screens positive for food insecurity, they're offered the opportunity to connect with a social worker and or a dietitian. So what interventions result from that connection might vary based on what are the needs. I can certainly speak from the social work perspective. If we're talking about primary care social workers, your primary care social worker is potentially going to be the one screening them, or they may be the person receiving a veteran who has screened positive in another area. Or it may just come up as the result of a clinical assessment that they're doing, because that's just sort of part of the clinical assessment that we might do. And then we're going to tailor our referral for food services based on what type of food insecurity we're talking about. Are we talking about somebody who currently has empty cupboards? They're going home to empty cupboards. Are we talking about, somebody who has an acute food security related issue, a chronic food security related issue? Are there children at home? Is there a significant medical or mental health conditions? I'm just thinking about all of these other issues that come into play. I'm not just going to give you a list of food pantries if I don't think you can get there. Maybe you don't have a car, maybe you don't have transportation. So we need to talk about all of these different things. I'm not going to refer you to a grocery delivery program if your medical needs prevent you from being able to cook. So assessment, assessment, assessment. That is the name of the game. And that is, to me, where VA shines so brightly, that we have this ability to do these really comprehensive interdisciplinary assessments at the facility level. And that as a social worker sitting in a primary care clinic, I can reach to my dietitian who's associated with that clinic, or a dietitian who's associated with primary care. I can make a warm handoff. I can, as part of my assessment, know that there's another branch to this tree. There's something else that needs to be addressed. And so again, kind of viewing food insecurity as that 5-lane highway where all the disciplines kind of get involved, and then tailoring the interventions specific to that. But part of the conversations we typically have with medical centers who reach to us for consultation is, what are the needs? What are you seeing in your population? If you're looking to develop your food security programming at your facility, is an on-site food pantry going to meet the needs of your population, or would something like an emergency food assistance situation, would that meet the needs of your population? Do you want to focus your interventions? Not every medical center has an inpatient hospital per se. So do you want to focus your interventions on your veterans who are users of your inpatient healthcare system, who you're discharging home and not wanting to send them home to empty cupboards that may or may not continue to contribute to their medical conditions? So it's individualized based on the veteran. It's also very individualized based on the facility.
It was thorough, and I think that's what everyone was looking for. And I just really want to thank you all again for participating in this today. Food security is one of our most demanded topical curiosities from our network, as reflected in our registration and attendance numbers today. And I think this was a really valuable conversation. I just want to remind everyone that I will send a recording of this video to everyone who registered once it becomes available. It usually takes about a day or so, and or a week or so, I apologize. It'll be on our YouTube channel, and I'll send it out from there, along with some of the resources we discussed today that we put in the chat. I'm also going to drop a link to our next upcoming webinar, and we'll include that in the follow-up email as well. I'm going to connect with our wonderful panelists here to see if there's anything else they want to include in that email and ensure it gets in your hands, including their contact information they're dropping into the chat as we speak. Thank you guys all again for your time today. We really appreciate your participation. And to everyone in the audience, please feel free to share these resources once you receive them via email to any colleagues or partners that you have in your community that may benefit as well. Any final words from anybody?
Just thank you so much for the opportunity to be with you today.
Thank you. Reach out.
Thank you, everyone, and have a wonderful rest of your Tuesday.